Good afternoon. Today is August 5th, 2009. Welcome to the Andre Lounge. I am Andre. Today I've decided to tackle an issue that I've been long avoiding. Today we're going to be talking about health care reform. More specifically, the Obama health care plan. I don't know if you've been locked away in a cave or under some rock. It's been in the news a lot lately, so today I've decided to give you my thoughts on Obama's plan, what I see, my assessments, uh, my overall thoughts on it. The Obama plan basically has 8 key points. It's a little more longer, but I'm going to give you a hybrid of what it is exactly. The goals of Obama's health care reform plan is to reduce long-term growth of health care costs for businesses and government, protect families from bankruptcy because of healthcare costs, guarantee choice of doctors and health plans, invest in prevention and wellness, improve patient safety, assure that it is affordable to all Americans, maintain coverage even when out of a job, and barriers for people with pre-existing conditions. Now, some key things that I wanted to throw in there. 16% of GDP, which is gross domestic product, is spent on healthcare, more than any other nation. The average cost to America per person for healthcare is $7,439. That's as of 2007. Healthcare is rising faster than raises. 15.3% or 45 million Americans are without coverage in the U.S. And for as much as we spend on healthcare in this nation, worldwide we're ranked 37th, according to the World Health Organization. And mortality rate is higher for African Americans, Latinos, and other ethnic groups in comparison to whites. Now, my thoughts. I have about as much faith in health insurance companies as I do in oil companies. I feel like they're all out to get us. What is baffling to me is, whether you like Obama, whether you agree with his practices, his policies, his views, or not, you have to admit the man is on to something. The reality is we have a lot of people who do not have insurance, and those that do, many times, can't afford it. And the premiums are going up and up and up. And wages are not, especially in this economy. What angers me is that we've spent millions of dollars. Millions of dollars is being spent by the healthcare lobbyists for the politicians, and in many instances I feel like the politicians aren't even representing the view of the people. I will say this much. If the politicians in Congress have not learned anything, look at the 2008 election. It was an election about change. It was an election about going another direction. And if you're not representing the view of the American people, just like the Republicans were voted out of the White House, you will be voted out of Congress. What angers me is that we're making a political issue out of something that should not be political at all. The thing about healthcare is that healthcare, it doesn't know black or white, rich or poor. Everyone's going to get sick. Everyone's going to die. Just the way it goes. Death doesn't discriminate if you're Muslim. Death doesn't discriminate if you're Christian. Death doesn't discriminate if you're green, yellow, pink. If you're born in this world, you will die. At least from what I've seen. And I don't understand what's the deal. I don't understand how we can spend $7,439 per person In the U.S., 16% of our GDP is spent on healthcare, yet we rank 37th in the world. We are the policing nation. We are the nation that the other rest of the world look up to as a guide as to the way things should be. We are a powerhouse, yet our healthcare system is screwed. And for you Republicans, I'm really getting sick of you, because it's like, you didn't go along with the stimulus. You didn't like it. You didn't have a plan. You thought Obama had lost his mind. Yet, one of your more prominent Republicans, John McCain, has admitted here recently, it worked. You don't like Obama's healthcare plan. Yet, you don't have a plan. I'm saying it's okay. Fine. You don't like Obama's plan? Why don't you have something different? And for these people that aren't representing the views of America, what are you there for? Because the reality is, you have 45 million Americans who don't have insurance. And that has to be addressed at some point, either now or at some point. And what is more baffling to me is you have one of your more prominent senators, Ted Kennedy, battling brain cancer. What would Teddy do? I mean, come on. All I'm saying is, whether you agree or not, America needs comprehensive healthcare reform. Y'all know it. Do something about it. If you don't, I believe it's going to hurt you politically in the end. Well, that's all I got to say about it. Thank you so much for watching. For all things Andre, you can keep it right here on the Andre Lounge, or visit me on Facebook, www.facebook.com/GooberGrace. That's Goober. Thanks, and take care.